Have you ever been told your pain is all in your head? Imagine living with pain all over your body, yet people, even doctors, question whether it is real. That is the story of fibromyalgia. It affects millions around the world, mostly women, and for many, it feels like an endless fight just to be believed. I am Dr. Angela Mailis, and today we are talking about fibromyalgia, what it really is, where it came from, how doctors diagnose it, and why it still causes so much confusion. For centuries, people have struggled to explain widespread pain. Early doctors centuries ago used terms like muscular rheumatism, thinking it came from bad body fluids. As medicine evolved, the name changed to fibrositis, and by the 1970s to fibromyalgia. It literally means pain in muscles and connective tissues. But for decades, many physicians doubted the condition. There is no blood test, no x-ray, nothing you can measure. And that made it easy to dismiss. In the 1990s, the American College of Rheumatology offered the first official criteria. Doctors would press certain points on the body to see if they caused pain. Later, questionnaires replaced physical examination, asking for other things like fatigue, poor sleep, and what patients often call fibrofog. Questionnaires made the diagnosis easier, and in my opinion, far too broad and far too easy. I say this because in my own practice in Vaughan, Ontario, about 10% or more of the women who come to my pain clinic arrive with a fibromyalgia diagnosis. And yet, in some of those cases, I discover instead other causes, arthritis, nerve damage, or other conditions that were responsible for pain and were missed. The challenge is that fibromyalgia can become a convenient label for people who complain of widespread body pain. It is real, but it requires careful thinking. There is still no scan or blood test that can prove it. So diagnosis depends on experience, context, and listening to the full story. Other conditions that may cause pain in many body sites must also be ruled out. On the top of that, other conditions can coexist together with fibromyalgia. We do know is that fibromyalgia is not a problem in the muscles, bones, or joints. It is in the way the nervous system processes signals. Normally, your brain and spinal cord filter pain messages from the body, turning the volume up or down. In fibromyalgia, that volume knob is stuck on high. Ordinary sensations like touch or pressure can feel painful. At times, even smells and sounds are far too intense. So, what turns the volume up? Usually it's not one thing. Certain genes might make someone more sensitive, but almost always there is a trigger, a physical injury, an infection, or more often, a major stress or emotional trauma. Once the nervous system goes on high alert, it keeps reacting, even when the original trigger is gone. In my patients, I often see a pattern. Long-term stress, early life adversity, or anxiety and depression existed years before the pain began, on its own or after some physical injury that may actually be very small. The strong link between emotional distress and widespread pain is well established in research, and I have witnessed it repeatedly in real life. A powerful example that brought this illness into public view was the story of famous pop singer Lady Gaga. In 2017, she had to cancel a European tour, telling fans she suffered from severe physical pain. Later, she revealed it was fibromyalgia, with fatigue, mood changes, and widespread sensitivity. Her symptoms began after a hip injury that required surgery, but years later, she described something remarkable. She was finally pain-free. Fibromyalgia is not imaginary pain, but to be realistic, it is a difficult problem to manage. It's the body's alarm system stuck on high alert, shaped by stress, biology, and emotions. It takes skill to diagnose and courage to live with, but understanding it is the first step towards healing. In our next episode, we will look at what drives fibromyalgia inside the brain and how Lady Gaga and many others learned to turn that pain volume down. If you found this episode helpful, give it a thumbs up, share it, and subscribe to the Pain and Wellness Health channel for more real stories and science you can use. See you in our next episode on fibromyalgia.